vaccines is one of the most important evolution in health and science that we had in the last couple of 100 to 200 years. You know, it's what we are seeing now, the prevention of health, prevention of death, that vaccines promote is short of a miracle. And it's, for me, it's mind-boggling to see that we still have so many people that disbelieve the impact of the vaccines, that the impact that the vaccines have in the world, not only on an health scale, but also on a social scale, on an economical scale. And it's to see the evolution that we had last year, for example, with COVID-19, and it's how the science managed to approach this situation, response to the needs of the population, presenting vaccines in a record time. It's I think it's one for the history. So I think this week will be very important to remind people that, you know, vaccines really help to shape the world as we have, a safer world. I think that there are still some places that still need more support. We are seeing right now, even with the COVID vaccination, you know, different velocities with different countries. But I think it's something that we can discuss further. But for me, it's something to be really proud of, to be part, to see history in the making with the COVID vaccine, and to see how we managed to evolve as a society with the help of the vaccines.
From the Nordics, of course, and I fully understand all of your points, George, and just to underline, the World Immunization Week seems to be a part of that storytelling about the importance of vaccines that we are trying to communicate at the moment, and also trying to see the result of in societies around the world. So of course, for us, it means here in the Nordics, it means a very, very interesting week with a lot of focus on vaccines in general, and on also just the opportunity to actually inform and educate about the value of it.
So the World Immunization Week is very important and precious, because we understand now that vaccination can save lives. It's very concrete because we can see it with people who do not contract COVID. And it's a bit complicated in France because we are the country of Pasteur, who discovered several important vaccines for all the world. And on the other side, we have French people who don't want to talk about vaccine, who don't want to hear about vaccines. And we have to educate, communicate, and reassure these people just to go on and save France.
Yes, that's an interesting contrast, isn't it, of having been instrumental in inventing vaccines, and then the population saying no, thank you.
Yeah, that's the French people. And it's very complicated because we saw that during the first wave of COVID in France, everyone was waiting for this vaccine just to get out of this crisis. And now that we have several vaccines for people, I think that maybe half French people don't want to be vaccinated. And not only old people, even people from 20, 30 doesn't want it. So it's an issue. It's a really important issue for us.
Mm-hmm.
Yes, I think we'll explore in a little while what some of those reasons are for people saying no, thank you. I think World Immunization Week has never been so high profile as this year. I have never tuned into that week as much as I have this year. And I think, you know, for obvious reasons, it's on everybody's radar. and I think it's an interesting one, because I've engaged in vaccines, you know, from childhood. I was vaccinated as a child. I have vaccinated my child against all those childhood diseases. I've had vaccines for traveling in the past. I had to have a yellow fever vaccine to go to Brazil many years ago. But I think the difference now is we have a global reason to vaccinate the entire population. And in my lifetime, I haven't seen a global vaccination program to that scale required before. So just the sheer scale of it, and, you know, as George was saying, the size and scale of that feat that has been achieved in one short year is phenomenal.
Yeah, it is, and I think for us, thankfully, here in Portugal, the vaccination is mandatory until 6 years old. Different kinds of vaccines. So if you want to go to school, you have to have the specific type of vaccination completed, which is I think it was very important for us to now, as we are now here in Portugal, for the population to embrace the vaccine, of course, with some questioning, especially with the communication that we have been dealing with. But we now have we don't have a lot of vaccines still, but we have a lot. We have about, right now, 8% of the population is fully vaccinated. 21% is already has at least one dose. We are in the second stage of the vaccination for COVID, and people are embracing. You see the pictures in the TV, big lines outside the vaccination centers. Well, that's because, you know, older people tend to go earlier than they should, because, you know, you tell people go at 10 o'clock and older people arrive at 6 o'clock or 7 o'clock because they feel that, okay, if I get there earlier, they will give me the vaccine, which isn't the thing that happens right now. But at least for us, what we are seeing is I think the people are embracing the vaccination process, especially older people, with much confidence, even though they have some side effects that are everything is a side effect. And I believe that the problem is the communication that the institutions have been presenting to the general population, especially on an European level and on a local level. And that raises some issues and some questions that shouldn't be raised, especially amongst younger people that say, I'm too young, I don't need the vaccine, I will get my immunity on a natural order, everything will be all right, so I don't have to worry about the side effects, etc. But I think this week will also help to, you know, talk about some topics and myths that are also come with the vaccinations and the vaccines that should be addressed, and the World Health Organization should address it on a very objective perspective.
Well, that's great to hear that people in Portugal are queuing up and want to be vaccinated. That's yeah. Very good to hear.
Send us more. We'll do it.
We are very lucky in the Nordics in general, and especially also here in Denmark, that the vaccine skepticism is very, very low in general. So with COVID-19, there has never been as much talk about vaccines. So that skepticism that you see here in Denmark is just a sign that we actually are talking about vaccines a lot more than we ever have done before. So I believe from the beginning, when the talk about vaccination actually started, we had a 65% plus positive rate, which is what you need for immunization. So that was a very, very good baseline compared to France, Sophie, as we have talked about before. That was the opposite in the beginning. So I actually think that everyone here is willing to do what they need to do. There has been some skepticism, but the government entities has been really, really good at communicating. We have seen the former director of the Danish Medicines Agency taking live interviews with skepticism or people that are skeptic with vaccines, and having a very calm, humble, constructive dialogue with these people, not agreeing, but simply communicating. And I actually think that gives a really good view on the situation here in the Nordics, that we discuss things about vaccines in general. We have had, it was back in 2014 and 15, the latest, we had a very, very big trouble with HPV vaccination within younger women. And that was a very, very bad media case about some adverse events that were connected to the vaccine. But the media broadcast about that situation was far out, to say the least. And that, of course, made the positivity towards the HPV vaccination very, very low. So it took a lot of years to gain that back, and also a lot of studies to see that the adverse events, or the thought adverse events to the vaccination, was not true. So that is a situation where we could see that communication from a media broadcast really turned over the situation. And the horrible thing about this is actually that people in Denmark, there will be some who will die from not being vaccinated for HPV. And that's, of course, that's the hard truth about that. So very, very strange that we are a country and a region with good positivity towards vaccinations, but then sometimes that just happens, a bad story, and maybe also a bad handling of situation from doctors or government bodies that turns out to be a very, very hard vaccine skepticism.
Yeah, I love what you say about the government having conversations and just communicating with skeptics, without trying to convince necessarily. Because I think sometimes that can come across as propaganda in its own right. If you're just telling everybody this is the only answer, it's going to fall on deaf ears if you're a skeptic. You know, you need that open dialogue and conversation to hear the other side. So that's really interesting. And I didn't know about HPV vaccine in Denmark going through trouble either. So.
It went through a lot of trouble, but now on the other side, the positivity towards the vaccine is back on the level it should be. We also began vaccinating boys. So it actually turned 180 degrees, but it took a lot of work. And as you say, Claire, it's really, I think a lot of it is about accepting the skepticism. It is about seeing that there will be skepticism, and then people have their reasons for it, and that is what you need to listen to, and that is what you need to communicate with. That point cannot be taken for granted. If we just say, all right, somebody over here is skeptic, but we're not going to listen, that's where we know that it can get out of hand. And especially in these situations during COVID-19, where we have never talked about vaccinations as much on a global scale on the same time. Everybody knows the different vaccines. Everybody have read about them in the medias. Everybody have read about adverse events or how many vaccinations you should get. So it's become a talking point, a conversation point in everyday dialogue. Which vaccination are you going to get? That we have never seen before. So I actually think there is a golden opportunity here when we are having Immunization Week. There's a golden opportunity to say, all right, if vaccination is to be a regular conversation point, how can we shape it with evidence, data, and then still having that humble, calm, constructive way of communicating? I think it's a really good opportunity to even lift the future of vaccination. When COVID-19 is over, and we are still going to talk about vaccination at some point for other diseases, now is the time to shape it.
I think France should take example from Denmark. We have a very, very bad communication from the government. France doesn't talk to skeptics. It's just, you have to be vaccinated, because if you are not vaccinated, it's not good. That's all we hear during the day. And I think media have a very important impact on what French people think, because I don't know how it goes in your countries, but in France it's very complicated because all the information is very dark. We talk about only side effects, and so people are afraid. They don't want to die because of vaccination, but they don't know that they can die about COVID-19. And that's the big challenge, I think, for governments. We have our first minister getting his dose of vaccination around in front of all the cameras just to make people vaccinated, but it doesn't work. Or the media made fun of him, and so it was not a very good idea, I think, for my side to make it. I don't know how to change people's minds, but in France, vaccination has always been a very important issue, because we had a bad story too with hepatitis B. Lots of side effects on young people. And from this time, vaccination was over for French people. Even parents didn't want to vaccinate their children unless it's mandatory in France to go to school. And they ask doctors to write papers to prevent their children from being vaccinated. So we have a big issue in France. And I think that this week is a very good opportunity in France to talk about vaccination, that vaccination can save lives. It's not only side effects, because every drugs have side effects. And we have to understand it in France, and it's a very big work to do.
Yeah, that whole communication around risk has come to light again, hasn't it? And how you explain to somebody the relative risk of vaccination compared to other risks, you know, with the same condition. So the blood clot issue, we've seen a lot of communication in the UK around your risk of a blood clot with smoking or the contraceptive pill compared with the COVID-19 vaccine, and how much lower the risk is, just to try and give people perspective and to make a more informed decision, because it is a difficult one. You know, you think, well, I don't want to take something while I'm healthy that might make me sick or might kill me. That doesn't feel right to anybody. So yeah, it's communicating that risk to people, I think, is also quite important.
I think so. I think you and Christian and Sophie also mentioned the key. You know, the key word is communication, or field of expertise, which is you know, it's physicians communicating to the patients, national entities communicating to the general population, international entities communicating. So communication has been the key word, one of the key words to address the situation, to decode the science to us all, not us all because we work in this field, but to the general population. And you now have a problem. You now have a problem when you know, for example, here in Portugal, we are doing right now a study regarding the sources of information for the population, and we just received the preliminary results. And for example, for the Generation Z, 65% of the Generation Z says that they go to the social media to receive the information. They don't go to TV. They don't use TV. They don't use online press. They don't use especially print press. And when you have the source of information, a very dubious source of information, of course this will help to increase the issues regarding vaccines, issues regarding health, because we have a lot of fake news going around. We have a lot of sources that aren't scientific, without scientific value, and that creates a problem to us all, because when the younger generations don't tend to they just go to the online sources, social media sources, and they believe what they read without comparing to other more scientific sources. That brings a problem of communication for the government, for us all, and that is something that we must deal with. It is something that we must work with our clients, with our partners, and it's a challenge. It's also a challenge.
Yes, I think as you probably know, the COVID-19 vaccination program in the UK is going exceptionally well, better than anybody expected it to. We're approaching 70% of the population being vaccinated, which is incredible.
It is.
And I think it's largely in part to the communications that they've got that right. They've actually got it right. And the channels of communication in particular, to your point, George, because they've been working in so many different channels of communication, and working, for example, with faith leaders to reach certain religions who might be skeptical of a vaccine, who wouldn't really pay any attention to the media, whether traditional media or social media. The only person they would listen to is the faith leader. So they're working with mosques and synagogues to reach those whole populations through the channels that are most meaningful to that audience. And it's working. You know, we've seen much higher rates of acceptance in Black and minority ethnic groups than we were expecting to see. And I believe that's largely down to good communication and through the right channels.
Yeah, it seems like almost what you're saying, Claire, is usually what we do with all of the work that we do with our clients. When we help them, when we help them communicate, of course we would say we have to know the audience, and we have to use the right channel for the right audience. And if you get that right here with vaccinations and COVID-19, of course you will see an effect. But if you don't do, there's no doubt that this, of course, could go in a very wrong direction.
Yeah.
So it seems like you have done a very, very good job in UK.
I think that it's the French mistake. We didn't know the audience. We didn't communicate sorry, on the right channel, and we see the results now. We have to communicate on each channel for each audience. I think that's the only answer.
Yeah, there was great concern even in January this year as to whether people were going to respond to their invitation and to get the vaccination. And, you know, and it's proving to be very successful. There is skepticism, of course, as there is in every country, but it's being tackled head on. And I think initially the skepticism was around the speed at which all these vaccines suddenly were identified, because people question me, how come there are other diseases, malaria, for example, where no vaccine has really been developed for years and years, and then all of a sudden within 1 year we have half a dozen vaccines available that suit the whole population. And I have to explain that this is not just been developed in the last 12 months. This is years of research, coming up with the science behind it that required almost a pandemic to test it and see if it worked. And fortunately, in a number of cases, it has worked, and it's brought lots of vaccines to market very quickly. And obviously, a lot of the side effects that that are being talked about only come to light when you start vaccinating entire populations.
Exactly.
And that's happening much faster than it would ordinarily. So normally it would take years to identify possible side effects. But because everyone's being vaccinated so quickly, and the level of evidence being collected is kind of on fast forward. So what would normally take years is coming to light much faster than it would normally.
And even how for example, the vaccination, sorry.
Yeah.
Or at least here, even as the vaccination center are arranged, it almost it's you know it's for people to feel that, okay, you're going to be vaccinated, then during an half an hour you're going to be seated in a special room with cookies and people just waiting to see if you have an adverse reaction. So when you go to the vaccine, you're already thinking, okay, it's mindset. It's also plays around but it's true, like you said, it was a very quick, the number is very high, the vaccination number is very high, so of course every treatment has some kind of side effect. We are different as a person on a molecular level, so we respond on a different level. And that's why people say, okay, my husband didn't have anything and I had 2-day headache and my body felt like I was made some marathon or something and I couldn't, and nothing happened to my husband. It's not fair. Well, it is what it is. It's
we are all different.
Exactly. And respond on different levels.
But people sometimes doesn't understand that. As you said, there are millions and millions of people getting vaccinated and 10 people getting side effects.
Yeah.
And people just focus on the side effects and not on the life saved. And that's the problem.
Yeah.
I think we are still very lucky in Europe that we have access to these vaccines.
Sure.
That we have the infrastructure to get them to people quickly, whether or not people are accepting of it. We're in a really lucky and fortunate position in Europe that we can, someone can have a vaccine if they want one. And I feel very lucky to have had my first dose of my COVID-19 vaccine.
Was an emotional moment for you when you
very
received?
Emotional.
Okay.
Yeah.
No,
I'm ashamed to say.
No, it's completely normal. Yeah, exactly.
But of course, it's not good enough that the UK is doing okay, because in this global pandemic scenario, not enough for one country to protect itself.
Yeah.
In fact, it's pretty useless if other countries surrounding us and further afield are also not having access to the vaccine and are not opting to be vaccinated. So it really is, it needs to be a global effort if we are to get out of this. It's not enough just for the UK to be doing okay.
Oh, it actually is a very, very good example on how much we depend on each other. We usually don't think of that much within healthcare, but
Yeah.
this is a very, very good example on how we are interconnected, and it brings value for all of our countries if everyone are doing well here. So it will be very, very interesting to see how if UK can be the good example to that all of the other healthcare systems get up to speed. Of course, that would be very, very interesting.
And of course, I do just want to mention some news today that Oxford have announced some successful results around a malaria vaccine. Excellent news in World Immunization Week, because it has taken a long time to find a vaccine that's this effective. They've reported 77% effectiveness in malaria, which does affect millions of children in vastly poorer countries. So great to see good news coming out in other areas of health this week as well.
Yeah, but that's a perfect example on such kind of news that the discussion about COVID-19 and vaccination should actually help the story and the news about malaria vaccination become even more important. And also, hopefully, the discussion about vaccination in general has been more mature now for that vaccine to be launched. So that societies and populations will be more eager also to get the vaccination.
Yeah. I think one thing that helped this situation was to put on the spotlight researchers and scientists. They usually were on the shadows, and they bring to the communication a more natural and decoding messages, at least some of them, and it helps to see someone that is a researcher all the time and is talking about freely in the TV or radio, and not only about COVID but other investigate research. And I think it was very important for them to come back to the spotlight and to bring some scientific level to the discussion, and people at least understand the issues.
I think it's really, really important that with every audience, we have to meet them at eye level. There's no reason to dismiss any audience's approach, especially from government bodies in such situations as COVID-19. So I think moving forward, and if there will be so much discussion about vaccination ongoing even after COVID-19, it's just really, really important to accept everyone, to at least take in the arguments and having the dialogue. It doesn't have to be a head-to-head heated discussion, constructive dialogue in a calm and humble way. I think it's just really important, because there's no doubt that in Denmark, when a lot of these girls, they experienced horrible side effects that they thought was the HPV vaccine, they didn't get the attention that they needed. And then they thought, first of all, this has been something to do with the vaccination. And then it became true. And there were never any constructive dialogue about it. And maybe that could have been hindered if there had been eye-level dialogue and in a constructive way. So I think that's just really, really important to take on in the future when we communicate about this.
I think you're right, Christian. Dialogue is the most important part of communication, and we see it in France. Unfortunately, they don't communicate. They communicate between head to head, as you said. They don't dialogue with real people who doesn't understand, in fact, what is happening. And I think that we, as we say at the beginning, we have to use the right channels to the right audience. I think if we don't have it now, we have to learn and do that on the next times now. And we have to be very concrete and just give the information we have to understand.
Well, I think for me, like my colleague said, it's dialogue. It's very important. I think on the other hand, I think it's important to humanize the entities, because it's really something that it's for me it's pisses a little off when you have international companies being subjected to some criticism, and you don't have anyone talking because some of the companies have in an international communication strategy. We had a good thing happen here in Portugal when some communication started regarding Pfizer and not delivering the vaccines, the right number of vaccines. We had the country manager, which is a Portuguese one, going to the TV stations and being interviewed without any responding to all the criticism and explaining that it's a very thorough situation and they need to analyze everything. The factories need to be ready because this is a very scientific process. And that was one of the things that I think work well for the sake of the pharmaceutical companies to have one of the country managers talking about it. And the other thing, I think it would be less politicians talking and more researchers and medicals and staff working is talking about the situation, because we see that they don't really understand that they are doing, they are responding to a new situation with the best that they can, I believe. But sometimes it's the political discussion isn't very helpful for us to understand and to us and to the general population to go through the that they need to wear masks in the streets, that they still need to be careful. Of course, everybody's tired of this situation. We all love to go around, but it's better when the researchers and the scientific community comes in and communicates on a different levels. I think it's a better strategy than to just give the politician the stage.
The only thing I would add to all of that, which is all very true, is with immunization in particular, is to remember the bigger picture. Mm-hmm. We would not have eradicated entire diseases had we looked at the micro impact of vaccination. We have to look at history and what we've achieved in doing that as a much bigger picture. And it's the same situation we're in now. We have to look at the bigger picture, not individual instances, but what is it we can actually achieve if we all do this together.